Hello parents, I'm Dr. Shailesh Khode, consultant otolaryngologist, sleep apnea surgeon and working in Abu Dhabi, United Arab Emirates. Today I'm going to talk about the adenoids. Do you think so it's a guardian of your child or an enemy of your child? Have you noticed as a parents your child is snoring nowadays a lot or they falling sick very frequently, need an attention from the doctor to give some medications, or they keep on coughing a lot even after giving adequate medications, especially in the night time, or they are getting treated by the pediatrician or the chest physician by giving a lot of nebulization, steroid medication, getting eczema is exacerbating, or growing child, you have noticed that the teeth are not coming appropriately. You are seeing they have developed some crowding of the teeth. But when your child wake up in the morning, are they grumpy even after 8 to 10 hours of sleep? Or you are visiting your ENT specialist or the general practitioner for a recurrent ear infection, for that your child needs to take an antibiotic, another medication, or your child teacher, or have you noticed that your child is not responding very well? You notice there is some hearing issue, there might be the fluid behind the eardrum, or is your child is waking up in the night, they feel restless, they feel breathless, or nowadays they don't have much focus on their study, they are very less attentive, or recently I've noticed that they are developing some attention deficit hyperactivity. Last but not the least, is your child is afraid to go to the sports day, they don't want to run, they always find to catch the breath, they keep their mouth open while running, they don't feel very comfortable, then there must be something going wrong. In that case, it can be enlarged or persistent adenoids. So what is adenoid? Let's talk about it. These are the lymphoidal tissues like tonsils, as you see in the throat. They are behind the nose or above the palate in this area. Well, how they work? The initial function or the primary function of the adenoid is to build up the immunity up to the age of 5 to 7 years, and they help to fight against the germs that your child breathe in via the nose. But what happens with the adenoid eventually? They grow up to the age of 5 to 7 years, as I said, to build up the immunity. After that, they start shrinking and it does not have any role to build up the immunity. And at the end, we notice that they are completely disappear by the 7 to 9 years. However, in some kids, if they persist, they start creating a trouble to all your child. You are visiting the clinic very frequently for all those trouble. You might suspicious of the adenoids, or your physician should suspicious of the adenoid and consider refer to the ENT to rule out hypertrophic unwanted adenoids. What is the step ladder? How we proceed? When you visit to the ENT clinic, first of all, we do the detailed examination and assessment to understand how severely that hypertrophic adenoids creating a trouble for your child. And we really suspicious of how the adenoids, we perform the X-ray neck of your child to look for the size of the adenoid. Sometimes the child is very cooperative. We can do the small camera examination that going through the nose to look for the size of the adenoid. And once we confirm they are enlarged adenoid, inappropriate for that age, creating a trouble for your child, we proceed with the optimal medication in terms of giving saline spray, topical steroid spray, antihistaminics, and sometimes we need to give a short course of steroid. Even after optimal medication, if they still persist and keep on creating a trouble for your child, you have noticed that whenever you are giving medication, child is feeling better, but once you stop the medication, again the symptoms are coming, your child is falling sick. What next? In that case, after proper evaluation and the discussion with the parents, we come to the conclusion that now we don't need that adenoids. We might need to consider the surgical removal of the adenoids. How we perform the adenoids? We use the endoscopic coblation technique. It's a different kind of a technique in which we melt the adenoids, camera going through the nose, and we are passing the coblation wand through the mouth to melt all the adenoids. The blood loss during this procedure by using this technique is almost 0%. However, we need to perform this operation under general anesthesia, means your child is sleeping throughout the procedure. It takes around 20 to 30 minutes to melt all the adenoids completely. After surgery, child will shift to the recovery and to the ward. They start eating and drinking normally. After 2 hours, considered as a daycare surgery, child can go home after 4 to 6 years. But we advise parents to keep the child at home at least for 3 to 5 days to avoid any infection. By using these endoscopic coagulation techniques, we have noticed that the recurrence and the coming back of these adenoids is almost zero, even though the literature mentioned that they grow back in 20 to 30% kids. So parents, whenever your child is having all these symptoms, your child is grumping, not sleeping well, always having the trouble, please consult your nearby ENT surgeon. Thank you very much for your attention.